long the sperm lasts inside the woman?
Very good question. Outside of 72 hours, outside of that range, the chance of you getting pregnant becomes less and less.
What about the freezing eggs? Can you tell me about that?
It's the in vitro fertilization process without making embryos. We do a procedure, we do it in our clinic at Michigan Fertility Institute. We suction out the eggs from each ovary, and then they're prepared, and then they're frozen in a tank, as long as you want to freeze them.
How long take sperm to renew?
The sperm cycle is 3 months. What we want is the sperm cycle to regenerate. Sperm is going to regenerate, and if you do a semen analysis today, the result is probably going to be much different in 3 months.
What's the number for the perfect size for the egg?
16 millimeters or 18 millimeters or 20 millimeters. We call that mature. Once they reach a certain size, we say, okay, these look like mature eggs. They're going to be good quality eggs. And the ones that are smaller, less than 10 millimeters.
Hey guys, and today's episode Beyond the Chair is going to be with Dr. Ali Bazzi, infertility specialist. How are you, Doc? Thank you for coming, and I really appreciate you. What lets you get into infertility specialist, and why?
When I was going through medical school, I wanted to see, one of my mentors, I see the biggest impact they had on someone was giving them the gift of life. Now, every aspect of medicine, they do a great job. Everybody affects people, whether it's through their heart, or people that operate on the brain, on the bones for athletes. For me, I wanted to do something very miraculous, and that's help people create the next generation of kids and families. And infertility is what hit for me.
That's amazing, bro. When should couple consider visit fertility specialist?
Yeah, when a couple has been trying to have a child and they're having unprotected intercourse for up to a year, if the female partner is less than 35 years old, in about a year of trying, they should come see a fertility doctor. If the female partner is 35 years and older, we say 6 months.
Okay.
Of trying regularly to have a kid.
How does it affect women fertility?
Actually, fertility affects both the woman and the man, surprisingly. But from a woman, it affects several different ways. A lot of times it's their egg count. So, for you to have a baby, you need egg and sperm combined to make an embryo, to have a baby. So for a woman, if her egg count is low, or there's an issue with her tubes or her uterus, that could affect fertility. And then for men as well, too. Actually, men play a big role with fertility.
Okay. Now, a lot of girls, they taking birth control. Mm-hmm. Should that pills affect a woman fertility later on?
Overall, with the birth control, people have been using birth control for a very, very long time. Sometimes what we've seen is after a woman's been taking various birth control for an extended period of time, sometimes it makes it a little bit challenging for them. Their menstrual cycle may not start off right away, and they may have a little bit of delay until they're back to their normal regulatory pattern. So sometimes it makes it a little bit difficult getting pregnant. And if that happens, and we talk with them and we do other testing to see if it's from the birth control or there is really an underlying fertility problem.
But does it affect them?
Overall, usually when people they stop the birth control, their menstrual cycles return and typically do not have many issues. But obviously, if they're on the birth control, they take that so they don't. For one reason, they take it so they don't get pregnant. So,
what sign that women have fertility problem?
A lot of different things. The biggest thing is going through that period. I mentioned that the year period without, if they're trying regularly and they're not getting pregnant, that's one of the biggest signs is, there might be a fertility issue. Another sign is if they're having any sort of issues with their periods, if they're heavy, painful periods, or their periods are changing in terms of when they come, when they stop, how long. Those are some of the symptoms. Sometimes if they're having menopausal symptoms, like they're going into menopause early, that could be a sign that their egg count and the quality of the eggs is decreasing. So these are some of the signs they're looking for. But the biggest one is trying consistently but not getting pregnant.
Okay, so I have a question for you, Doc.
Yeah.
Which I think a lot of people, they have that problem. Which is the best and the worst? I mean, I want to start. What's the worst couple you've seen? They have problem.
You know, I've seen couples where their marriages are literally hanging by a thread. Their relationships are about to fall apart. That's how much pressure, stress, anxiety, fertility had on their marriage. To the point where they each had to talk to me separately because of the problems they were having.
Wow.
I mean, it affects people not just from a medical standpoint, but mentally, emotionally. Their relationships back at home are affected by it.
What's the issue with them? Like, was it the men or the woman?
You know, it's funny that you mentioned that. People come in and they say, "Oh, it can't be me. It has to be her," or "It's probably him." So it's a combination of both. Up to 40% of fertility issues actually due to the men, and 40 to 50% is something, an issue with the female. So, it's just not one person. It takes two to make a baby, right?
Yeah, 100%.
Yeah.
I have a question. What you said 40% is on the man, right?
Yeah.
So what would get what is the most optimal thing you would tell a man if he does have fertility issues? What exactly should he be doing? Let's say dietary wise, or let's say fitness wise.
Yeah.
What exactly should a man be doing to avoid issues with himself personally?
That's a great question. I always say, let's start off with what you shouldn't be doing.
Okay.
Some of the things I see and it's hard nowadays with certain things available and habits people have, but one of the things is don't smoke.
Okay.
I can't stress that enough. Don't smoke. Watch the foods you eat. Try to maintain a healthy weight. We call it BMI, or body mass index. Okay. Your weight and your height. Try to maintain a healthy weight. Exercise regularly. One of the things I've seen is, I see it too frequently in my practice where men are taking various supplements at the gym and anabolic steroids and testosterone injection. Even the testosterone injection, I hear it so often where men feel tired all the time and exhausted, so they go get a testosterone injection because they think their testosterone is low. But in fact, over time, that testosterone can decrease your sperm count. Yeah. Wow. And if taken consistently for an extended period of time, it could make you infertile.
So
yeah, I hear it too often where men say, "Doc, I just needed a pick-me-up or a boost. I'm just always tired all the time, and I get a testosterone injection because my testosterone is still normal, but it's a little bit low normal." So I always say, let me talk to you about taking testosterone. Let me explain to you why it may not be the best. Certain other careers or jobs that people have, especially, let's just say some men who work in an environment where it's extremely hot all the time near their pelvic area, like fry cooks near the stove all the time, that could affect sperm function. There's so many different things that affect the sperm. Yeah.
No way.
Working in places where you have high levels exposure to, we call it carcinogen or pollution in the air, compounds. These kind of things could affect.
In terms of the environment you work in, so I used to play basketball, and I was told you're not supposed to wear compression shorts.
Yeah.
Can you explain why you're not supposed to wear compression shorts? Because I never understood it fully.
Yeah.
And I heard it has to do with that as well.
Yeah.
So if you could elaborate on that.
So it comes down to, the environment down there in the pelvic area. When you're compressing the area and decreasing the temperature, sperm likes to be created in its optimal temperature. Even slight variations or changes in the temperature affect sperm production and function.
Okay.
Yeah. So I do ask all my male patients all these questions. You know, it's not a matter of how do you feel, are you tired? Well, we get into detail. Tell me about your job. Tell me about your food habits, your social life habits, alcohol, smoking, drugs, vaping, hookah, nargile, right? Tell me about your, you know, do you go to the gym? Do you take supplements? I don't just ask, do you take medications like blood pressure medication, but I ask, tell me about the medications you take, supplements, herbs, anything that you take on a daily basis, injections. All these things are super, super helpful, and you'd be surprised.
Man, you know, like you brought up the steroids. I always have a client. We always argue about that. They say, no, it's not, bro. That steroids. Hey guys, make sure listen what he's saying.
Yeah.
It's a reason. Like I bring people. They have a lot of knowledge.
Yeah.
Because a lot of people they need that.
Yeah.
They don't know about these stuff.
Yeah.
And I always get like different doctors, different business guys.
Yeah.
So what's the most common case for a male infertility?
You know, it's one of the things I've been seeing most frequently is they just lived their life, never really felt like they were doing anything wrong. You know, I get a lot of people who are not smokers, who don't take steroids, are just living normally, maybe a little bit overweight, you know, here and there, but they find out that their semen analysis or their sperm count is really low, just suddenly. There's no real exact reason why. This is why I tell people, especially if you're engaging any of these habits, let's have a discussion and talk. But even if you're not engaging in these habits and you feel like something's wrong, let's talk, because a lot of times we just find it, we call it incidental, meaning it's just there. You know, we find it without having a true reason as to why.
Can men improve infertility from exercise?
You know, depending on what the cause is, what we're finding, is it low sperm count, or is the sperm not moving, or the shape of the sperm? A lot of different things. A lot of things can be adjusted through either medication, through diet, through exercise, through giving up some of the things we talked about, the smoking, you know, watching what supplements and herbs you take. And then we never want to test the man too early. We want to give the sperm, you know, a few months to regenerate, and then we see how those changes impacted the men.
I have a question. So you seem really passionate about what you do as well. Where does that really stem from? Like, how did this become something that you're like, okay, this is a problem that now, like you mentioned the whole smoking, like the vaping, and I feel like it's so accessible now. You can smoke anywhere, in any building, outside, doesn't matter. So where did you come up with this passion to want to actually help people in this way?
Yeah. I think, you know, for me, growing up, I was always curious. I always asked, when I didn't know why, I would always ask questions, and learning something new, it was like a big aha moment for me, right? So when I growing up, talking to people around me, friends, family, and just realizing how much they didn't know about their own health, and then finding out when it's too late. For me, it was like, okay, if I can just, even through words, even through a simple maybe I don't have to treat you, but even through conversation, if I can teach you in 45-minute consultation hour, teach you so much about your health that you didn't know throughout your whole life, and then prevent you from going 5, 10, 15 years later and saying, now I can't have a baby anymore, I wish I would have known. If I can just do that, that just makes my whole entire day. Just being able to teach somebody and help and educate them more than what they knew from before.
That's amazing, man.
Yeah.
Can a lot of exercise affect fertility, or a little?
A very good question, actually. I always say too much of everything is not necessarily good, right? You know, we do know that people who are, let's just say you have your, hardcore, person that goes to the gym, the triathlon, works out extremely hard. I mean, this goes for women as well. A lot of times that could change their normal pattern every month, and that could affect their menstrual cycles, or that could affect sperm production. So you never want to go strenuous too hard. And if you are doing that and you're having issues, it's important to first talk to a doctor, explain what you're doing. We can run some tests. We can ask you some questions about your health, and better understand, better guide you to determine if you should be maybe cutting down a little bit, or you're doing okay. We always want people to exercise. Don't get me wrong. Exercise is important. But again,
not too much.
Too much of something, and then, doing things like taking all supplements and herbs and storage, those are the things we want you to avoid.
Doc, I have a question, which that really important, because especially in America, a lot of people has a lot of stress. Mm-hmm. Can stress affect partners to get the female pregnant?
We don't know exactly if and how stress does it cause infertility, but we know that it can make it difficult in terms of your overall ability and willingness to try regularly, to time things. And for example, like I mentioned earlier, trying every single month, maybe the stress affects your ability to do it at the right time. Or it could affect, just from a mental standpoint, you may not seek treatment early because you're just not in the right mental space. So, one of the things we say is, I always tell my patients is, I don't know how stress, and if it can truly affect your fertility, but it can't hurt to feel better, to relieve your stress, to do things that make you happy. Try to take a little break. Try to enjoy the process, because if anything, it can only help you.
Can infertility comes from like family?
Yes, the short answer is yeah, definitely. Some medical issues are passed on from family to family, and that can cause fertility issues. And that's why in every time I speak to a new patient, I do what's called a thorough family history, meaning I ask you about, are there any family issues in your family that get passed on from generation to generation? And then we focus on asking some of the things that may affect infertility. Like, for example, I'll ask, are there females in your family that go through menopause earlier that could affect fertility? Are there any medical illnesses or diseases that you have in your family that could also affect infertility?
Wow.
Yeah.
Can you, can you fix that?
It depends. Just like every question and answer, it all depends on what it is. Some of the things, if they're genetic, unfortunately, sometimes we can't fix it. If there's a genetic issue that causes you not to make sperm, sometimes it can be fixed. Some of the things that are passed on from family to family, like early menopause, or we call premature ovarian failure, where you go into menopause early, some things we can do is treat you earlier and freeze eggs earlier, so that can prevent you from not being able to have a kid later. Wow. So it all depends on what the issue is exactly.
So I have really important question. Always I seen a lot of
where you're gonna get with this. Yeah.
So what about the freezing eggs? Yeah. Can you tell me about that?
Yeah.
Because it's kind of crazy to me.
Yeah. It's freezing eggs as a term many people use if you're talking to people, or we use in medicine. It's called oocyte cryopreservation, meaning oocyte is eggs, cryopreservation is freezing. So freezing eggs. And what that is it's the pretty much the in vitro fertilization process without making embryos. What we do is we give a female patient medication. She takes injections every night, anywhere between 8 to 10 days, and we're causing her ovaries to grow a lot of eggs. We call it follicles. And when we're doing ultrasound, once we're happy with what we see, we do a procedure. We do it in our clinic at Michigan Fertility Institute. We do a procedure under anesthesia, and we go in and we suction out the eggs from each ovary. Then those eggs are prepared, and this is done in the lab, and then they're prepared, and then they're frozen. They're frozen in a tank, and they're frozen as long as you want to freeze them. Until you're ready to use them.
And they still, like, you can use them.
Yeah, great. Yeah. So whatever age you froze those eggs, think about it that way. Those eggs are frozen at that age. So let's just say a female patient froze her eggs at 30. And she goes through life and is not ready to get married or not ready to have kids, whatever the case may be, and comes back to me at 38. We know that a 38-year-old, 39-year-old, they're very young. They're still young otherwise, but it's going to be tougher to get pregnant than somebody who's 28 or 30.
Sure.
But the person who has eggs frozen at 30, her eggs are technically, think about it, kind of 30 years old still. And the patient is older, so she can use her eggs that are still young and healthier than if she were to use her eggs later.
What?
Yeah.
And is that procedure a painful procedure, or is it, like, talk about that?
It's an outpatient procedure. Typically, by the time they come to the clinic, by the time they're under anesthesia in our clinic, and by the time I do my procedure, it's about, a 15 to 20 minute procedure. They wake up. Most patients are awake, talking for the most part, a little bit dizzy from anesthesia, but by the time they get home, the next day they're pretty much doing much better.
That's
It's
awesome.
an outpatient procedure, yeah.
Is it like, autism kids?
Yeah.
Can these, like, kids, like, is it going through family? Or how that kids get to that? Like, what's the issue?
Going back to we talked about a little bit earlier is when I ask you about your family history, and if we're noticing there's the same condition or conditions that's passed on from family to family, or you have multiple people in your family with a genetic issue, sometimes what we can do is we can test you. So let's just say that you and your spouse, a wife and husband are together there, and they're telling us that they have something that runs in their family. Oftentimes we can test for that to see if they have that gene. And then what we could do, and you're gonna like this, is they can do IVF. We can get the eggs, we can get the sperm, put them together in the lab, create an embryo, and we can do genetic testing on the embryo. And we can find out if that embryo that's gonna be the baby, the future baby, if that embryo has that genetic issue, almost with pretty good accuracy. So then we can tell you, okay, I know, for example, Down syndrome runs in your family, but here are the embryos you got. Let's just say you have 5 embryos that were tested. These 3 have Down syndrome, these 2 do not. So now you can pretty much put an embryo back inside and have a baby with almost a very high chance that there's no Down syndrome. Actually,
Wow.
very, very accurate.
Wow.
Yeah. It's called IVF with genetic testing.
Is it kind of along the lines of, like, I don't know if you know CRISPR?
Yeah.
How it's like,
Yeah.
yeah.
Yeah, the CRISPR, there's a lot going on with genetics since we did the human genome back in the 90s, and with CRISPR trying to change certain genetic patterns. This one pretty much is what it's doing. It's identifying which of the embryos might have it so that we can avoid that embryo and only put back inside the woman's uterus the healthiest embryo.
Healthy one.
Yeah.
Wow, that's amazing.
That's a really important question. I think all the females, they have that issue.
Yeah.
How do regular period get relate?
Yeah. A lot of times that if your period is not regular, or we call it irregular, that could be a sign that there's something underlying going on. And some of the things that cause you to have periods that are not regular also cause infertility issues. But then sometimes even women who have regular, and this is what drives a lot of my patients crazy. They come to me, they say, but doctor, I've had regular periods all my life. I know exactly when I'm ovulating and nothing has changed all my life. How is this happening to me? Or why am I having fertility issues? So you can see both ways. You can have regular periods and still have fertility issues, or you can have periods that are not regular, and that can underline explain a fertility issue.
Okay.
Wow.
So this is why I tell my patients, just coming to see me, you don't have to come see me because you want to have a baby or you're having fertility. Sometimes you want to see me because
just to check. Just to make sure you're okay.
Just to make sure you're
Absolutely.
okay. And just, I always say, avoid Dr. Google. If you want, come and have a conversation. Let's talk about what are your goals. And if we need to do testing, we'll do testing. But sometimes just having that conversation.
And I had a side note question. So, do you think it's good to get regular like physicals just to make sure like everything about away from the whole fertility side, because that can also help with fertility, right?
Yeah.
If you make sure your body's right and in the right place, how often should people, men and women, go for like a physical or go for a checkup? Because I feel like that's very important in terms of a side of where you can go down the right direction.
That's such a good question because, I think it's super important to try to always maintain your optimal health. And how do you do that? You start off with your primary care doctor. You go and you get annual checkups. They check your cardiovascular health. They check your blood pressure. They check certain metabolic issues. They check for thyroid, diabetes, and so forth. And a lot of times the question may come from your primary care doctor or your OBGYN. Tell me about your family planning goals. Are you planning on having a family soon? What do you want? And sometimes that conversation you have with your doctor during your checkup just sparks in your brain the curiosity that, hey, you know what? I am having an issue. Or you know what? I do need to talk to someone about something. Because the one thing is, like I said all the time, there's a lot of things we can do and a lot of things we can't do. But one thing that we certainly cannot do as doctors or infertility specialists is we can't give you back time.
True.
I always say, that's the thing, that technology is advanced and, we have some of the, the latest technology in the clinic. But one thing that we cannot do is we can't give back time. So having the annual visits, talking to your doctors, talking to your providers will help better prepare you, not only from your health, but also for your future when it comes to family planning.
Amazing.
How long take sperm to renew?
Good question. The sperm cycle is, I always tell men that they come to me sometimes with an abnormal or not normal semen analysis. And they're like, oh my God, doc, I got to go check it tomorrow, next day, or the next month. I say, let's just wait. Let's just give it, let's wait 3 months. Let's recheck your semen analysis in 3 months. What we want is the sperm cycle to regenerate. And I always tell men to watch what supplements you're taking. Sperm is going to regenerate, and if you do a semen analysis today, the result is probably going to be much different in 3 months. So, wait it out. I know it's tough, a couple of months, 2 to 3 months, wait it out, and then we check it then. But I don't check it too early for those reasons.
How does weight cost overweight for fertility?
Overweight affects both males and females. From females, being overweight, it could affect their menstrual cycles, so their periods every month. It could affect if, how, and when they ovulate. So what ovulate means is they release the egg at the given month. Okay. It can affect those things. For men, it could affect testosterone production. When you have excessive weight, that could affect what we call your semen analysis, your concentration, so low sperm count. There's many things that could affect. I always tell patients all the time, I can't stress enough, maintain optimal weight. In fact, even as small as a little bit of weight loss, 5 to 10% of your body weight loss goes an extremely long way. It's huge. The positive impact that has, just even losing 5 to 10% weight. So I always tell people that are coming to me that may be overweight or obese, I say, don't get discouraged. Look what you have to do. If you lose only this much, it can change. And every day I see patients who come to me and they say, hey doc, I lost 15, 20 pounds and my periods are regular now. I know when I'm ovulating. I feel like I can get pregnant now. So weight is important. I always ask people, you guys are asking an amazing question, and it looks like you've done your research on it. What has been the biggest, most surprising thing you found when it comes to fertility that's like hit you on the head? It's like, I can't believe this.
Like I had one of my friend, he been trying, like I told him about you, He been trying, I think, 4 years. So he did everything, and they still. But when they check both of them, they good. That's surprised me.
Yeah. You know, that happens. It happens pretty frequently. So that's what's called unexplained infertility. So that means we check from a male's perspective. We check from a female's perspective. Everything is normal on the man. Everything's normal on the female. So then, like, you're saying to yourself,
is that like a genetic rejection or something?
Well, that's science. That's the beauty of science. So then, in about 10 to 20% of people, it's unexplained, meaning after we checked you, we still don't know why. And what that is, it's not that there might be something wrong. It's just, medicine, we're never 100%, right? We keep learning every year. We know more about IVF now than we knew 10 years ago. So it might be that we're still studying. There's still more that we don't know. That's the unexplained. 100%. But the good thing is a lot of those patients still get pregnant. We can still give them certain treatments and help them get pregnant. Of course, not everyone, unfortunately, has a success. Your friend, he may be in some of those people where no matter how much we try, sometimes it just doesn't work out. But that's when we start talking about other ways to have a family. There's other options.
Would that be like, for example, like surrogacy?
Surrogacy, gestational carrier, surrogacy, donor eggs, donor sperm, adoption, so forth. That's when we have to start having the conversation. What are you comfortable with? Some people have cultural, religious things that they will or will not do. But it's important to have that conversation to understand what's available out there. But you'd be surprised how many people, once they learn about what's available, and they're not reading at home, stressed at home, they're just talking to somebody, a doctor with the experience, who could tell them about other people and their experience. It makes them more comfortable.
Because they don't feel like it's just them.
They don't feel like it's just them.
How often couple they can try in a month to let his partner to get pregnant?
Yeah.
And which days?
Yeah. It's very important to understand that. What you're referring to is the window, we call the window of ovulation. So one is that period, those given days when the egg is released from the woman, and is the best time for the partner and the woman to get together, for the man and the woman to get together to have a baby. It's different, almost different for every individual. That's why I tell patients it's so important to understand your body, understand your menstrual cycle. And based upon how long your menstrual cycle is, how many days your menstrual cycle is, we can help calculate and predict and even do blood tests to tell you are the most fertile on these days of your cycle. So it's not like on the 14th day of the month. I want you to think about it as the 14th day of the menstrual cycle. So then at this given time, this is the most optimal time to try to have a kid. Anywhere outside of that, it's not gonna make a difference in having a kid, but we can help you to understand
the most optimal time.
The most optimal. And this is where a lot of young female patients come to me. They say, teach me about my menstrual cycles. I don't understand, what is ovulation? What does ovulation mean? What does a period mean? What does day one mean? So this is the whole point about educating, to help them understand when's the best time to have a kid and when's the best time to not have a kid.
Okay, is it, let's say after the
Ovulation, yeah.
Yes, can women get pregnant?
No, it's extremely rare. Once we have a window where this is the time where the egg and the sperm meet in the woman's tubes. Outside of this window, it's amazing. It's just miraculous how things have to work out absolutely perfectly. Outside of this window, sperm, if you do it too early, the sperm may not make it or may die, or the egg ovulated, it's too late, it's gone. So you really have to time things pretty accurately. Not to the exact second or minute, but you have this window of these fertile days where we'd want you to do it.
Wow.
Yeah.
How long the sperm last inside the woman?
Yeah, a very good question. You're asking all the great questions. Sperm is, outside of 72 hours, the sperm, sometimes it lasts a little bit longer than that, but outside of that range is the chance of you getting pregnant becomes less and less. Because remember, the sperm have to, cross the whole female anatomy, and lots and lots. Yes, of course, you have millions and millions of sperm going through, but a lot of those die on the journey, so that by the time they get to the tube where the sperm and egg meet, it is significantly less than the millions. You have only a few. So if you're waiting even longer than that, there's a good chance that no sperm is available after a certain period of time to meet with the egg.
I have a question.
Yeah.
Correct me if I'm wrong. I seen a video, and obviously it's never a good thing to start off with, but I seen a video, and it said that it put the sperm and the egg under a microscope, and it showed that when the sperm actually reaches the egg, there's a light, like it flashes, like not flashes, but you know what I'm trying to say, like it brightens, something makes like the egg bright.
Yeah.
Is that true?
So this is called the fertilization process.
So it is true.
I don't know if it's a light, but basically what happens is you have all the sperm that makes around the egg, and you have the sperm that gets through, breaks through the shell of the egg. You think of the egg, it's kind of like an egg, right? But it breaks through the shell of the egg, and that sperm that breaks through the shell of the egg, when it does that, it starts this process, this chemical biologic process that begins the fertilization process. Changes the composition of the egg and the sperm, and now instead of it being in an egg and a sperm, the combination of the egg and sperm is called an embryo. And that's when you start getting those pictures. You've probably seen it on our website. You see the ball of cells that are splitting. That's what starts that process. So that's the light.
Okay,
Yeah.
okay.
So I read a lot.
Yeah.
And I study a lot of things. I love that.
Yeah.
And
I can tell by all your questions.
And every person like I get here, I get a lot of knowledge from him.
Yeah.
I can use for different
Yeah.
episode.
Yeah.
So how normal size for a woman eggs, it's normal size to get pregnant? Is it like big size of eggs and smaller and smaller?
It's again, these are all really good questions. So one of the things we do is eggs that can be seen through a microscope, very high magnification microscope. So what we do is, by the time the IVF process where we suction out those eggs, immediately by the time that the patient wakes up and goes home, we have our lab team. They're looking through the microscope and they're looking at those eggs. They're looking at various things, the appearance of the eggs, the inside of the eggs, how does it look like? If things look, broken or it doesn't have all the necessary components, then those are considered immature or not good eggs. So we're looking the best quality appearing eggs. We can't tell you which eggs are normal. We can't genetically test the egg. We can genetically test the embryo, the sperm, but we are able to look and see which eggs look well. And then the most important thing is time. We see over time which ones continue to survive and change to the shape and form that we want them to change to.
What's the number for the regular size, like the perfect size for the eggs?
Like the optimal size?
It's, one of the things we look for during the IVF process, we're looking to see, so when you're doing in vitro fertilization, while you're taking those injections, you're coming to see me in the clinic and I'm doing an ultrasound and I'm measuring the eggs. We call them follicles, but within the follicles, the eggs. So I'm measuring and I'm like, okay, which ones are growing? Which ones are now 16 millimeters or 18 millimeters or 20 millimeters. We call that mature. Once they reach a certain size, we say, okay, these look like mature eggs. They're going to be mature follicles. These are ones that we're going to probably be able to get, and they're going to be good quality eggs. And the ones that are smaller, less than 10 millimeters, they're not good. So you can see extremely small. I mean, what's 10 millimeters, right? I mean, extremely small. But on ultrasound, I'm able to see them and say, okay, these batch of eggs probably are not going to make it, but these ones, they're growing. They look like they're the healthy ones.
So, side note to that question. So, there isn't necessarily I guess you'd say size doesn't necessarily matter in this situation. It's more the strength of the egg.
It all doesn't matter. Does it matter? Because I read about it. They saying the eggs gotta be certain size.
We want them to be, once it reaches a certain size, once it continues to grow, and now we're 16 millimeters, 18 millimeters, and we're continuing to grow, we're comfortable to say that appears to be mature eggs.
Okay.
And the ones that are less than that, you see them less than 10 millimeters, or they become smaller and smaller. Those are usually the immature, are not the best quality eggs typically.
Okay.
But the one thing that we look for more importantly is how many eggs can we get? Because, it makes sense. Like, if you're looking at a pool of, 100 eggs, there's a good chance, now I'm not saying we're going to get 100 eggs, but let's just say you're looking at a pool of 15 eggs versus a pool of 5 eggs. There's a good chance that you're going to get at least one normal egg from the pool of 15 as compared to the pool of 5. So it's a numbers game. We want to get the most amount of eggs we can to hope that at least we have good quality eggs in that bag to optimize it. Yeah.
What they call, like, when the sperm,
Yeah.
they go to the egg,
Yeah.
to the left or right.
Yeah.
So they saying they have, sometime they have like clock, like they close.
Yeah. So what happens is once you have, this is the fertilization process. Whatever that one sperm that gets to the egg and begins the fertilization process, we have a process that's called the egg. What it does is it accepts that sperm. That's what causes the fertilization, and then it blocks. It forms like a block to every other sperm around it. We call it block to polyspermy, meaning the egg is only going to be fertilized by that one sperm, and it blocks. It forms kind of like a brick wall over, and every other sperm does not able to get in.
So the sperm, they go to the left or to the right?
It really, you really don't know. It's one of those things where it all depends on the perfect, the harmony that happens. That one sperm that's able to get through and, go through the egg, break through the egg, and cause it to fertilize. And that's kind of what we talked about a little bit earlier. One of the things you look for in a men's sperm function is, we call it morphology, the shape of the sperm. So if you have sperm that are not normal shape, they won't be able to get through the egg. Or if you have sperm that can't swim, they're not going to make it to the egg. You see what I'm saying? Yeah. So these are the things we look for. So the healthy sperm, the one that's swimming, the one with the nice, oval shape, the one that's moving in the right direction, those are the ones that are typically gonna win. But to know which sperm exactly or which location, it's hard to know.
Can you tell us about the dye? I heard about the dye you put it.
Yeah.
Can you explain it to us?
Yeah, you really did your research, man. Yeah, that's really good. The dye test that you're referring to is called a hysterosalpingogram. It's called, or HSG. So it's a test we do where we inject dye, iodine dye inside the uterus, and under x-ray, so it's done in the radiology part of the hospital, we're injecting dye, and that dye shows up as it's colored white on imaging, on x-ray. So while we're injecting the dye, they're taking a lot of x-ray pictures. And so what we're seeing the dye travel through the uterus, and then it goes throughout your tubes, and we can see spill of the dye. So what does that tell me? That tells me that now I can have a good image and picture of the dye, and I can see that your tubes appear to be open, because if it's spilling out of the tubes, that means the tubes are open. And remember, we talked about it, that you need tubes to open. The sperm and egg meet in the tube. So if the tubes are blocked, let's just say the dye goes to the uterus and stops, and there's no spill, then you can very comfortably reliably say that the tubes look blocked. Meaning that's probably why you're not getting pregnant, because the tubes are blocked.
How they open it?
Yeah, that's a good question. Unfortunately, there's not a lot of ways, depending on what it is, but most of the times if the tubes are blocked, it's hard to reopen the tubes. The option would be in vitro fertilization or IVF. So you could still get pregnant. It's just getting pregnant the natural way is going to be very tough. So we would do in vitro fertilization.
So they have no option?
Except IVF, typically, most of the times. Yeah.
So there's no medicine to
there's some people they look at doing certain types of surgeries to remove the blockage, open the tubes. Again, how successful are these surgeries? It's really hard to say. Not a lot of people do these types of surgeries. Sometimes, with surgeries, there's risks involved with surgeries. Sometimes you can get scar tissue later that reblock the tubes. So a lot of times the patients ends up being in their best interest to just do in vitro fertilization or IVF. They still get pregnant. I mean, they do well. It's just they have to do IVF.
Is there a lot of people they have that? Like,
I diagnose tube issues every single week, multiple times a week. I have people who have tube issues. Sometimes they have tube issues because they tied their tubes. Sometimes they have tube issues because they had a history of a pelvic infection. Sometimes it just happens just because they've never had any issues, no medical problems, and their tubes are blocked. So you're not alone. If you have tubes blocked, it doesn't mean you're alone. It's pretty common.
You mentioned the tubes tied thing. I heard that there's a certain age where you're not supposed to, or you're not recommended to tie your tubes.
Yeah.
And is it reversible?
Yeah.
Like, if you just elaborate on that.
So one of the things is, again, this is so important why you should have the conversation with your OBGYN or your infertility doctor. If you're planning on tying your tubes, depending on what your age, we want to have that conversation and say, what if you're tying your tubes at a young age? We want to be able to say, okay, why do you want to tie your tubes? You may have a reasoning that we can help better understand and better plan for your future. You may be enduring a lot of stress, a lot of issues, had some really bad situation that happened that may want you to tie your tubes a little bit early. Or you may justifiably want to tie them early, and that's fine. But one of the things is we want to talk to you to determine if it's too early. Are you sure you're done having kids? Because yes, there might be a surgery to reverse it. I've actually was trained doing some of those surgeries. I don't do them as often anymore because of the success rate. Maybe we can reverse it, but we need to have the conversation. If you're too young, are you sure that in the next 5-10 years while you're still fertile, you don't want to have any kids? And as long as we have that conversation, we can come to a common ground.
This one really important question, which I don't know, the females, they're gonna hate me, but I hate you guys when you get to that.
I'm a female doctor, so the females are my favorite patients.
So when they get to the period, some females, they get crumpy. Some females, they have pain in their stomach. Some females, they have no issue. What does that cost when they have pain in the stomach? I really want to know because I hate that.
Yeah, it's when you have. So what is a period? Yeah.
You know why I ask you that question? Because I have females, they work with me.
Yeah.
I have like family.
Yeah.
Oh, don't talk to me. I'm in my period.
Yeah.
Like, okay. You're supposed to give me chocolate. You're supposed to. What caused that pain?
Females endure so much more than what men endure. Men can't handle what a female handles when it comes to this.
That's why
the pain.
they say الجنة تحت أقدام الأمهات.
Oh yeah.
Because how much pain.
Because how much pain they go through. Yeah, they go through the pain every single month or difficulties through child labor. I mean, as men, we have it much easier. The women really put up with a lot, and God bless them for that. The period, so what is the period? The period is fluctuations and changes in hormones. So you have a lot of changes in your hormone, your estrogen, your progesterone, all these other different hormones that come from your brain that affect your period. Your rises and falls of hormone changes the imbalance of the hormones. You also have, what is the period? You have your uterus, al-rahim, right? Al-rahim, it contracts. So you have this organ in your pelvis contracting, every month. So with the bleeding and the contraction that changes the hormone, it can affect pain. It can affect how heavy you bleed, how light you bleed. It could affect your overall mood, right? I mean, the fluctuations of hormone could affect you, overall, how you feel at certain times of the day. When your estrogen drops or your progesterone drops. So there's many different things that can impact it. That's why, every female is different in terms of their cycles, their periods. Some don't have any symptoms. Some have
a lot of symptoms. So when any of these are happening, it's important to have that conversation, because there's things we can do. There's things we can do to help you. There's medicines we can do. There's lifestyle changes we can do. We can teach you about your cycle so that you can better, address it earlier, so you can have less symptoms.
Wow. I'm sorry, guys. I didn't know like that.
Yeah.
So what's the difference between, like, they get heavy period and some girls, they got it light?
Yeah, some people, that's just their normal menstrual cycle. They come heavy, some come light. If it comes too heavy, we want to know, because we want to see, do you have a genetic or what's called acquired bleeding disorder? Do you have a disorder that causes you to bleed heavily? So we don't want you to lose too much blood. Or some women have things like polyps or fibroids, lahmiyya, inside their uterus. So like a polyp, we want to go in there and we can remove it, or a fibroid, they can cause heavy bleeding. Sometimes that's just their normal cycle, but a lot of times we can do some testing or imaging to see what may be causing that, and treat them. How often do you hear about people talking about fertility or trying to have a baby? I'm sure while you're cutting hair, you're spending 15, 20, 30 minutes with someone talking, maybe talking about sports or whatever, work. But do you ever talk about things that maybe men don't want to talk about, or fertility issues? Or if it's females that you're cutting their hair, do you ever talk to them about things that are personal, like fertility?
I mean, it's never too early to go ask. And it's really important to go and see the doctor and talk about it. Hey, my issue. You can fix it. Always, like, don't just keep it and, you know what, I don't want to go to the doctor. I'm okay. I'm good. Just go and check it. Don't wait.
I think personally, me being 23, turning 24, it's not something that is really talked about often. Even my older clients too, like, we don't really have those conversations, which I personally think is really important. Now, seeing what as men we can do to make our sperm count stronger, produce more, and be able to give your partner what you need them to give you. And I think it's very important now at the age that, like, around our age, like, I think a great point, Tief said it, was it's never too early. So number one, we got to get to it. Make sure you're okay, because if there is an accident or on purpose, you got to be ready for it. You got to know that what you're about to produce is a healthy human being that's going to grow, is going to grow up and do something, for you in return.
It's not just about, like, infertility. It's about health. About whatever you do. So one time, it's a great question you ask. Like, I don't get blood test. I don't like it.
Yeah, no one likes to go, right?
Bro, 5 years, I never seen any doctor. Alhamdulillah, alhamdulillah. God bless me with that. Because I usually eat, like, good food. I exercise. But I don't like to do a blood test. And then I got to the point, you know what, like, I gotta go. I went, I did the blood test. High cholesterol. I was pre-diabetic. I have kidney stone. I look at it, man, thank God, like, I won, and I checked myself.
And you always said, I'm young, I'm healthy. What am I going to have, right?
Yes. And I eat healthy. I eat a lot of sugar, but I gotta, like, I want to check. I want to see, because we have a genetic, diabetes. So I'll always make sure, like, I gotta be healthy. When I did that after 5 years, it comes up, man, I gotta work on myself more. After 3 months, like, I've been dying, I went test again. It was amazing, thank God. So everybody, go check. Whatever you have, any issue, go check.
I love when someone comes to me and after they leave, they know more about themselves.
100%.
And they feel better. Like, I may not need to treat them, and that's okay. But if I teach you more and you feel better about yourself, because who's going to take care of yourself better than you? If I can come to you and let's just say that we find out that you have low sperm count, or you have an issue that causes your eggs to decrease much earlier in life or affect your sperm, and we freeze your eggs and we freeze your sperm. We took care of that. So now go live your life, get healthy, do what you need to do. We're protecting your ability to have kids later. Or you learning about your heavy periods, what's causing that, and you're able to change it. And now you as the patient, now you're teaching others around you.
100%. 100%. Bro, I did that podcast, Doc, I swear. Because I want to learn more.
Yeah.
And at the same time, a lot of people going to learn more.
Yeah.
Because health is number one.
Without health, you have nothing. Health
Yes, yes.
Right?
I don't care how much money you have,
That
but
will
when
not
you
buy
get
health.
sick,
Yeah.
you forget about the world.
Yeah.
I really appreciate you for coming.
Of course.
Thank you so
Well,
much.
thank you.
And I'm sure like you're gonna get good deeds. You teach a lot of people. They're gonna see that.
Yeah.
Thank you, Gibbs, for an amazing
Excellent
haircut.
Yes.
I appreciate you.
Thank
You. Thank you.
And hey, guys, make sure go visit his lab, Livonia.
Michigan Fertility Institute.
Yes, it's really close. Amazing doctor. He's gonna make you comfortable, and you don't have to worry about anything.
Yeah.
If you need anything, just drop in the comment. We're gonna make it happen for you. Peace.
Thank you, everyone.